Hello. Hi, everyone. This is Dr. Erica, pharmacist. Thank you for joining me on today's live chat. I want to share with you some healthy, 10 of the top healthiest drug benefits or tidbits and behavioral habits that will help in the efficacy and safety of medication consumption. And so today, that's what I want to go over, and I'm glad you're able to visit this YouTube channel, and I want you to subscribe if possible. There's a little subscribe button there. If you would push that button and be a subscriber to this channel. I'm Dr. Erica, founder of Millennium Pharmacy. My website is themillenniumpharmacy.com. You can visit that website at any time, shop, pick out merchandise, and leave any comments or suggestions down below about any topics that you would like to hear about or would like for me to just make mention of. So please let me know about that. I am a pharmacist. I did close to 9 years pharmacist. I've become more independent now in this new year, and I am still giving out consultations, good, healthy information for everyone. Thank you for joining me. If you're new, please subscribe and like and share with others. So I'm going to go over 10 of the most special healthy drug taking habits. And you might already know this. It's mainly for this particular video is mainly for maybe beginners who are newly diagnosed and with a new medication, or someone who is new to taking medications completely, someone who just needs a review or an update to taking medications, or someone who maybe just who have come across a hurdle or obstacle that has slowed them down in taking their medications on a regular basis. So that's what I want to go over today. Okay, so the first number one is going to be just being consistent with taking a prescribed medication or over-the-counter medication. That will include taking a medication dose as prescribed daily or weekly or as prescribed again, and then also making sure you take that medication at the same exact time each day or each week. So for example, if you're going to take let's say metformin 500 milligram for diabetes, you're going to take that 3 times a day with I guess with a meal. Let's say you're going to take it at 8 a.m., 12 p.m., and then you're going to take it again at 6 p.m. So what I'm saying for the first healthy tidbit is going to be take it consistently. You're going to take it every single day of the week at 8 a.m., 12 p.m., and then at 6 p.m. for consistency's sake, so that the body can adjust properly to the consumption and digestion and elimination of the medication. The body will become normalized to that medication, and the more normalized the body becomes, the more natural the body becomes with the medication. And so the medication can work effectively and properly and will not be toxic to the body. The body will not be off schedule or off in any type of form or fashion. The body will be more natural to that particular medication if it's taken at the same exact time, whether AM or PM, multiple times a day or once a day, and taken every day of the week at the same time. Okay, so that was the first healthy tidbit. And then the second healthy tidbit I'm going to go over is storage. Okay, so medications are like food. If you want to say, medications should be stored away from moisture in the air, away from heat, because moisture can bring heat as well, and away from sunlight. That prevents degradation of the medication and the preservative state of the medication. This medication will not seem crumbled. It won't seem mushed or tampered with or anything like that. When you open the bottle to take the medication, it'll still be the same in the original container as the day you picked it up from the pharmacy. So do make sure that all medications are stored in its proper location, away from moisture, away from the restroom, away from where there's a lot of heat, and away from sunlight. So that would be maybe in the cabinet, keep it in the cabinets, or in a locked closet, anywhere away from pets and children as well. That would be included in number two. And then also, just let's make sure that those patients who are cognitive impaired or not have access to medication cabinetries and medication storage. So let's be mindful of that as well. The better the storage, the longer the medication can last, the more efficacy and the more safety the medication can maintain. Most medications are enteric-coated, or they're either that or immediate released. And so that plays a part in the digestion of the medication. And so it should be preserved. And then also insulin pens. Insulin pens should be stored at in the refrigerator at times, and it also can be stored at room temperature at times. So be aware of that, depending on which type of insulin that you are using. Also, other anti-diabetic injectables can be stored room temperature or refrigerated as well. And also patches. There are some estrogen patches that can be stored in the refrigerator. And then so be mindful of that as well. The third healthy habit that I want to go over is separating medications from antacids. Antacids and proton pump inhibitors, or PPIs, can alter the GI tract acidity and basicity in the body, in the stomach lining. So do be aware of that when you're taking an antacid, like magnesium citrate or calcium, any type of Tums or any type of medication over the counter or prescribed that's going to interfere with the acidity, the change in the stomach lining. Do separate with other medications by 2 to 4 hours difference. And that includes the proton pump inhibitors as well, like your pantoprazole, your Protonics. Those type of medications in that class should also be separated from other medications for best efficacy. And also, there's plenty of other medications as well that should be separated. So do be mindful of that when picking up medications, and your doctor and your pharmacist should speak to you face to face and let you know of that if that is the situation in your case. Okay, number four, drug taking habits would be don't share your medications. Medical devices should only be for personal use only. They are prescribed. They are just for you because they are specific for your situation only. And then we don't want to cause any cross-contamination of bacteria or viruses of such. So we do want to make sure that all syringes, all pen needles, any injectable medication, any devices like diabetic devices for testing, test strips, test machinery, even blood pressure machinery, things like that, you should use very, very strict caution and should be used only with a particular individual, okay, for avoidance of infectious transfer or anything like that, just for safety as well and for healthy living and hygiene, okay? Also, Number five is going to be reading the package insert that comes with prescribed medications, RX medications. Also, OTC medications come with package inserts. So do read about the package insert information. There's sometimes pertinent research and analysis that take place. And so that material is usually embedded in the package insert or manual. So do take a look at that as well. And that'll give you some a very lot of beneficial information as to how to take the medication, whether you take it day or night or with food or without food, separation from other medications. That pamphlet will give you all that information. Okay. Number six says to discard all medications that are expired, all medications that are no longer being taken. They should be gathered and sent to the local health department of your city or your town. They can most likely direct you to where those prescriptions can be discarded. Usually medications can be grounded up with coffee grounds and discarded in the waste that way, or they can just be contained in the original container, bagged, and taken to the sheriff's department or taken to the health department in your local town or city. But do be informed that medications should not be eliminated in the trash raw, or it should not be sent into the commode system raw. So that way contamination cannot occur. And also it is safer to not take expired medications. So if you have expired medications, do not take them. Just hold on to them until you can properly have them discarded. Okay. Number 7, avoid missing doses. That goes with number 1, consistency. Avoid missing doses. If you miss a dose of a medication, go ahead and take it as soon as you can remember to take it. Okay, when you take it as soon as you can remember to take it, if it's not so close to the next scheduled dose, then go ahead and do so. But if it's so close to the next scheduled dose, miss that dose and go ahead with your regular schedule. Sometimes a pharmacist or healthcare provider will tell you that, okay, it's okay, just double up. The package insert can tell you best how to handle that, depending on the medication, depending on the time that it's scheduled to take. The package insert holds all that information, all the studies and trials, all the studies and trials that led up to the FDA approval is in the package insert. That data can tell you how to handle missed doses appropriately. And it's specific, those pamphlets are specific for each case. So in general, what we tell patients is if you miss a dose, take it as soon as you can remember to take it, and then keep to your regular schedule afterwards. Okay? Number 8, do ask questions. Don't avoid taking the time to speak with your healthcare provider. Before leaving the pharmacy, speak with them, have a sit down, have a consultation at the window, and ask the questions that you have to ask. Okay? They will make time for you. Okay, and plus they can also give you any demonstrations that you may need. Demonstrations like how to inject diabetes insulin, how to use a pump inhaler for asthma or COPD disease, how to properly use eye drops, how to properly use a medical device that's over the counter. Those type of questions can be addressed at the pharmacy when at the time of purchase or at the time of picking up a medication. Don't hesitate to do that. Okay. Number 9, early refills. If you're traveling, or if you're going to not be away from, or if you're going to be away from the pharmacy where you normally pick up your medications, ask for early refill so that you can have that medication already on board when it's time to travel and when it's time to be away. Okay, that way that avoids any complications ahead when you're away and you don't have your medications. Some patients, they hustle and bustle to try to get that medication out of town or overseas. And then there's nothing the home pharmacy can do because that medication was not filled ahead of time. So there's a lot of red tape. There's a lot of back and forth communication with the doctor's office, with the nurses, and then with the pharmacy. So do your due diligence and go ahead, get your medications ahead of time, maybe 2 weeks to 4 weeks ahead of time, and keep them prepared and for travel where you're going to not be in your normal routine. Okay. And then last but not least, this goes back to the package inserts again. Some medications do best on empty stomachs. Some medications do better with a meal. Some medications do even better with a fatty meal. So therefore, the package insert, again, will let you know how best to take a particular consumed medication, okay? The pharmacist can also let you know, and they should let you know upon consultation of a new prescription. They can sit down with you if you like to have a talk about your medication, but do understand that some medications are better absorbed and better effective to you with a meal, without a meal, with a fatty meal, with milk, with water. So do be aware of that. It's good to know an all-around general idea of each individual medications that you may be taking. You might be on one medication. Research that medication. Understand that medication back and forth. Know what's best, how to use that medication, because that medication is for you to receive the best benefit and outcome and quality of life. So do be aware of that, okay? So that was the top 10 health tidbits that I wanted to go forth with. And then, if I may mention, some pharmacies do offer synchronization. Synchronization of medication dispensing for an individual will help with consistency of taking the medication. It helps with picking up all of your medications at one time instead of several times out of the week or several times out of the month. You may have the option to pick up your medications once a month or twice a month, just keeping all medications in sync. That way, you have a better control of your medication consumption and the benefit of receiving all medications out of the whole group. So do be aware of that program. Some pharmacies do offer that, some do not, but do ask that question to your pharmacy. And that's all that I had. If you have any questions or comments, please let me know. I'll be happy to get back with you about any other healthy tidbit, drug habits, taking habits, and I will be available. Please like, share, and subscribe. And I hope this information was beneficial to you. Thank you and have a great day. Bye-bye.